आज मैं आ चुकी हूँ महानगर में डॉक्टर रोहित खन्ना के क्लिनिक में. First of all, welcome, sir.
Hello.
Can you please tell me something about yourself?
I'm Dr. Rohit Khanna, a practicing dental surgeon and a specialist in the dental health care and an orthodontist as well.
So when it comes to dental, I would like you to tell us some of the instructions you would like to give to the mother in case of the child's dental health.
Now, something which is very important that we have noticed that mothers tends to feed the children during sleep. Now, during sleep, the milk gets stagnated into the oral cavity, and this stagnated atmosphere tends to give rise to the increased colonization of the bacteria onto the tooth surface, resulting into the decays. Now, these decay is actually tends to eat upon the softer tooth, the milk teeth, which are softer in nature, and this decay is so fast that it is known as rampant caries. Rampant means it is a very fast burrowing caries. It tends to take away the whole tooth structure within 6 months if it has been if it is actually into its full pace. Second thing is, while sleep, the milk can trickle down to the through the eustachian tube, where the children tends to get the middle ear infection. Many a time the child is crying, the cause of the cry is not known. It is anticipated either it's a stomach ache or it's an earache or it is this thing. It is all because that the milk has trickled down during sleep to the eustachian tube. Hence, no milk, no feeding during sleep. And in case ever it has to be done, it has to be followed by a water bottle so that the stagnated atmosphere is flushed away and it goes inside the stomach.
So what are the other precautions which a mother should take?
As soon as the mother finds that there is the eruption, finds the eruption of the teeth, she can buy a finger brush which is soft, and the finger brush is being worn on the index finger, and this index finger is goes all around the teeth and the tongue and tends to clean the whole oral cavity of the children without any toothpaste or without any medicaments. Just wet that brush and clean the whole oral cavity of the child.
So when it comes to bad odor, is bad odor one of the the result of all these things?
Yes. Now this is very interesting. Bad odor, 70 to 80% of the odor is because of the bad tongue, because the tongue is a hairy structure, and the food particles and the colonization get stuck between the hairs of the or the taste buds of the tongue, and this collected food particles get rotten onto the tongue surface and lead into the bad odor. There are certain sulfide producing bacteria which are being actually which are responsible for the bad odor. Hence, tongue cleaning is a very important component as far as the treatment of the bad odor is concerned, apart from treating the teeth.
So last question, you would like to tell your patients something, some precautions, some message?
Well, dental health should never be neglected, because treating a child for a rampant caries for any is something which is very difficult, because child cooperation is questionable. Second thing, the dry atmosphere is not attainable by the dentist. Hence, many a times, if it is very necessary, then we might have to resort for the general anesthesia, and that carries its own risk. And hence, I would always like to initiate that it is better to take precautions than to go in for any treatment. So, brushing, taking the oral health, the milk teeth has to stay till the age of 12. Hence, all precautions should be taken that milk tooth or deciduous dentition should not be extracted till the age of 12. And in case it has been necessary to take it out, the proper space maintainer should be given, because the milk teeth tends to act as apart from chewing, it acts as a space maintainer for the permanent dentition to come into the oral cavity. In case they are shed early, the permanent dentition, a permanent succedaneous tooth tends to go hayward, and then they lead into the malalignment of the teeth and another set of problems which is likely to be taken care later on.
Thank you so much, sir.
You're most welcome.
As told by sir कि हमें dental problems को इतनी lightly नहीं लेना चाहिए. Precautions हमेशा better होते हैं cure से. भावना कपूर, कैमरामैन नयन यादव के साथ, thenewsborn.com.